one of the things that happened, I remember, John, you had strained your lower back in there. The sprain area is when we talk about tendons and ligaments, usually bone to bone type thing. Strain is mostly the muscle. It can include the muscle belly and the tendons, soft tissues like that, the fascia as well. And so we're doing a nice little gentle traction on the lower back. And this area helps hydrate the disc, stretch the spine, open up the facets, the joints of the back. You can feel it, John. Can you feel that stretch back there? Okay. Now we put them up at a higher angle here. You can see how the table's elevating here. When the disc has herniated sometimes to the side, we can add some bending to it to help open that area up, to help with some of the pain and getting enough pressure. If I remember right, did you feel more on the right or more on the left?
This is my right.
Yeah. Can you feel it now?
Yeah.
You all right?
Yes.
And then I can gently place my hand right on the spinuses, right at L5, L4, and he probably feels you feeling more pressure when I do that. So I'm going up the spine. This helps open up this area right here in the lower back, especially if there's any herniations to the back as well as to the side, or what we call posterolateral to the side as well, or combination of both. So that's where a lot of his pain was. So we're getting a nice stretch in the muscle through here, through the joints here. Funny how when I work with people, I remember patterns with each of you guys. Not always, but the only time I have a really hard time remembering things is when people have replacements, you know, like shoulders, hips, knees. I always have to ask for that. Good. And now we're going to bring it back to center. You good?
Yes.
And we're going to release the middle section here. This changes the pull as well in through the lower back. So I like to incorporate at this point in his treatment. So John comes in every 2 to 3 weeks. He's had some visitors, so we haven't seen him in a month. Does a lot of standing, long 10, 12 hours, even more than that. But I like to incorporate with him where the adjustment occurs at the furthest traction point right there. So we're adjusting the pelvis. Now we're going to adjust the sacrum. Good. Tighten that up. Good. And then while it's tractioning as well, I use the instrument sometimes. I put John on the side as well. So right at S1, L5, L4, and through this area. This is his primary area. Good. Take a deep breath in and release it. And then we bring him down just like that. So when you're suffering with low back pain, these are some of the techniques and styles and things that I utilize to help with that. We use heat, we use a massager, we use hand adjusting, different traction and distraction into that area. So if you're suffering with low back pain, give our office a call, 360-951-4504. I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington, your local Seattle-Tacoma chiropractor and member of Chiro Trust. I'll see you guys soon. Bye-bye.